I'll be performing somatosensory examination. Firstly, I'll be checking for primary sensation, that is location of touch. Sarah, could you hold your hands and close your eyes and let me know if you feel any sensation of touch. Can you feel it?
Yes.
Now?
Yes.
Okay. Now, could you please localize the site of touch for me? Okay. So she has done. So she has normal sensation. She could recognize the sensation of touch as well as the location, which means she has intact dorsal column medial lemniscus. In patient who's unable to localize the site of touch, indicates there's a lesion somewhere superior to the thalamus. Now I'll be performing cortical sensation, but make sure before performing cortical sensation all the primary sensations are intact. Firstly, 2-point discrimination. Sarah, let me know if you feel 1 point or 2 points.
1 2 1 2.
So make sure to apply equal pressure on both the points and gradually minimize the distance and record the value where the patient can perceive only 2 point as 1. Now I'll be testing bilateral simultaneous touch. Sarah, let me know where you feel the touch, on left or right or on the both sides. Okay. Close your eyes.
Left forearm, right forearm, right side of the face, left side of the left forearm, both sides of the face.
Okay, done. So her response is normal. In patients who are able to perceive the sensation separately but unable to perceive it simultaneously, meaning there is a lesion contralateral to the site of affection in the parietal lobe. Forming graphesthesia. Sarah, you have to identify the letters I'll be writing on your palm.
T, C, R, A.
So her response is normal. In patients who cannot perceive this, indicating there is affection on the contralateral side of impairment of a parietal.
So now I'll be checking for conscious proprioception. In that I'll be first testing the joint position. So yeah, I'll flex your elbow at a particular position. You'll have to replicate the same position on the other limb as well. Okay, just close your eyes. Yeah, can you replicate the same position? Okay, good. That's all. Yeah, thank you. There's nothing. So if you ever have errors, that would imply that there's any impairment in your peripheral nerves or the spinal cord, brainstem or cerebrum. Now let's move on to joint movement. I'll ask you whether your fingers upwards or downwards. You'll have to tell me.
Down, up, down, down, up, down.
Okay. Do you feel it?
Yes.
Do you feel it now?
No.
Feel it?
Yes.
Do you feel it now?
No.
Okay. So yeah, this is basically done for testing your large A beta peripheral nerves. On to pain, that is your lateral pain, sharp and dull. She has to distinguish between sharp end and a blunt end. Okay. Just close your eyes. Just let me know what do you feel, whether it's a sharp or a blunt end. Okay, just call it out. Yeah. Close your eyes.
Sharp.
Can you localize it as well? Okay.
Sharp.
It was a blunt.
Sharp.
Okay.
Sharp. Blunt. Sharp.
Her normal response is quite good. She can distinguish between a sharp and a dull end. So yes, and she can localize it as well. So yeah. And if at all she has difficulty to distinguish or localize between sharp versus dull, it's basically there might be either complete loss of sensations of your peripheral nerves, or your anterolateral is affected, or your thalamocortical radiations could be affected. Just help me distinguish between warm or cold when I place it along your skin surface. Okay.
Cold. Warm. Cold. Warm. Cold. Warm. Warm. Cold.
Okay, good. You could distinguish between warm and cold. Now we would go for discriminative localization and conscious proprioception. That is your stereognosis. Okay, I'll place some objects in your hand and you'll have to identify what they are. So just close your eyes. Can you lift your palm up for me? Yeah. You can as well feel it, touch, and just let me know what is it. Okay. Can you feel this and tell me what is it?
Eraser.
Okay.
Sharpener.
Okay.
A pen.
Okay, great. So yes, she can identify the object